At Ilkley Grammar School, student mental health and well-being is very important to us. We want our students to better understand what mental health is, as well as give them strategies that can help them achieve a high level of well-being. As part of personal best time, our students are given the opportunity to explore these two areas. As part of mental health, we want our students to understand that everybody has mental health. Sometimes it can be good, sometimes not so much. And that it is perfectly normal to fluctuate up and down a scale of low mood to high mood. That can happen over the course of an hour, that might happen over the course of a day or a week, and that fluctuation is pretty normal. Sometimes people might experience mental health differently because of the environmental factors that lead to emotional responses. But those emotional responses will last different times, and there's no point in comparing emotional response to the person next to them. Emotions are transient and they do not last. But in terms of well-being, we want our students to understand that a high level of well-being is very achievable. And we want them to recognize what that looks like. We want our students to be happy, productive, and engaging in positive and meaningful relationships with others. And what's important is that as part of their daily routines, there are lots of things they can do to develop good mental health and achieve a high level of well-being. Every student at Ilkley Grammar School is given an interactive mental health and well-being handbook that focuses on 4 main areas. Firstly, exploring the terms mental health and well-being, strategies for self-care, strategies for support when they might be struggling, and what to do when they might need to talk about things. In terms of self-care, what we want our students to understand is that positive mental health and well-being is achievable through action, and that by developing and building action into their lifestyles, they can keep these things at a relatively high level. The handbook includes strategies for physical activities, emotional activities, social activities, and practical activities. We also understand, though, that at times students may be struggling, and the book also helps them by highlighting little booklets that come from the Mental Health Foundation with strategies to help them deal with certain situations. One is how to look after your mental health. The other is how to manage and reduce stress. The third, overcoming fear and anxiety. Also one for looking after your mental health with mindfulness, one for exercise, and the other, how to promote better sleep hygiene. The other app that we encourage our students to use is an app called Think Ninja, and this helps them deal with stress, anxiety, low mood, unhelpful thoughts, and negative thinking. It adopts the systems used in terms of cognitive behavior therapy, which helps students to retrain their brain and think of things in a different way. It's free to all students and has a specific section on dealing with stress in terms of anxiety about COVID. We also have a section about what to do if students need to talk. The Kuth App is another app we encourage our students to download. This has an online magazine with helpful articles about promoting good mental health. There are the opportunity to take part in discussion boards and complete a daily journal. But the Kuth App also gives our students access to online counselors 365 days a year through a chat function. This is anonymous, and students can use this as a first instance if they feel they want to talk something out. The other option is that students can talk to some of our staff. Every one of us will struggle at some point with our mental health, and if some of those strategies that are in the booklet aren't working, we would encourage our students to talk to friends, parents, family members, teachers, tutors, heads of year, and the pastoral team. The other thing we're very lucky to have in school is Place to Be. Place to Be provides counselling and support with things like low self-esteem, mood swings, and trouble with personal relationships. After students have worked through the mental health handbooklet, There are places available in things like Place to Talk, where pupils can book appointments with a Place to Be counsellor to talk about their problems and worries. One-to-one counselling is available and possible group work. The opportunities are available through a referral through their head of year. And at the same time, there is also a shout function where students can text P2B on that number and get access to help if and when they need it. In terms of over the course of the year, though, students will download that handbook and save it to their iPads, ready to access whenever they might need it. They can explore the chapters and the hyperlinks. They can download both those apps, ready to access when they need them. School also has a program of mental health eye leaders, which are Year 12 volunteers who will have training on mental health. They will be planning and delivering training and support to all other year groups in personal best time later in the year. We also have a Student Mental Health and Wellbeing Week. In this week, students will have the opportunity to explore strategies that can promote good mental health and well-being.